We will go ahead and get started today. Hello and welcome you to UC San Diego, everyone. Thank you for joining our webinar on health requirements for incoming students today. This webinar is presented by Student Health Services Director of Nursing, Annie Horn, who will oversee the incoming requirement process for the university. The student health nursing team is the one that will be our main point of contact for this process. They are here to support you as you work through these health requirements. Again, this webinar is recorded and will be posted on our website. I will drop the link in the chat. Many of the frequently asked questions will be answered throughout the presentation, but we will also have designated question and answer time at the end. And with that being said, I will turn it over to Annie.
Thank you so much, Helen, and welcome everybody to UC San Diego. We're really thrilled that you want to join us today and learn about all of your incoming health requirements. This is one of the early requirements that you need to do before everything else. So myself and our team are here and available to you to support you through that process. So we'll make a start on our slideshow for you. Okay, so as Helen said, I'm the Director of Nursing and Helen is moderating this session with us, and so she'll be helping with questions. Please drop your questions in the Q&A and we will get to them. And I first of all just want to establish why we have incoming requirements, and really this is for protection of the entire community. All of our incoming requirements are centered around vaccine preventable communicable diseases, primarily respiratory spread diseases. And so we know that living and learning in a university environment brings us all into contact with lots of people. So to have as much protection in our community as possible is a real advantage, because outbreaks that we see on occasion cause a lot of disruption to your study and to your degree and needing to take time off. And so we have over the years seen outbreaks of cases of tuberculosis on campus, of mumps, of measles, of chickenpox. So we really want to ensure that there is as much community and herd immunity as possible to keep us all well and safe. And the health requirements include tuberculosis screening, and this involves a questionnaire. And after you've completed the questionnaire, if you are deemed at higher risk, then you will be asked to provide TB testing. We also have immunizations and vaccines, which include Tdap, MMR, varicella, which is chickenpox, meningococcal, and COVID-19. And I will get into these specific vaccines and what the requirement actually looks like clinically as we go on in this session together. And you will also have the opportunity to ask questions. And then COVID-19 and influenza. Well, that requirement generally falls once you're at school. And for many of you, COVID-19 is now in the US an annual updated dose. We're no longer referring to it as a booster dose. And so that you will be able to either get before school, either you will have already had the updated dose since September, or you will aim to get the updated dose in fall of or winter of 2024-25. And how do I start? So really, I'm going to give you a bit of a show through a live demo of our Student Health Services website where all of this information can be found. The landing page of our website has a quick link into the health requirements, so you always know that you can get there very quickly. And absolutely everything, like Helen mentioned in the chat and at the beginning, all the forms, all the deadlines, there'll be a recording of this webinar, and there's information on exemptions. There's everything you could possibly need to know. If you remember nothing else from this webinar, remember that everything is housed on our Student Health website. So we might go to that now, Helen, if that's okay. Wonderful. So I'm going to share my screen now. And this is the Student Health website Student Health Services website. This is our Pharmacist Rex. And as I said, you will be able to learn lots more information about what our services are on here, including insurance, because lots of people have questions about insurance. So rest assured, you'll be able to also locate all of that information on here. But for today's webinar, we're talking about health requirements for incoming students. And so this is the page that contains everything. It goes through where you do these requirements, which is via our EPIC portal called My Student Chart, which is the student-facing part of our electronic health record, which is completely confidential and protected by HIPAA. We have the deadline information. If you are prompted in My Student Chart to do TB testing, the form is right here for you, and you can print this off. I've also included lots of good instructions and links on the front of this form, and then this is the TB testing form here that you would take to your healthcare provider, only if you're prompted to do so. And many people will be prompted, particularly if you're coming from outside of the US, or you've had a positive test in the past, or you have worked in a high risk area. So just be on the lookout for that when you complete your questionnaire. The immunisation requirements are also here, including our form. The form is you don't have to use our form, you can use your own records. But the great part of this form is that it gives you lots of information on how to actually achieve compliance, like, for example, Tdap 1 dose on or after the 11th birthday. So it guides you as to what we're looking for in terms of what each compliance on each vaccine is. And it would also assist your healthcare provider if you need to go and get missing vaccines or blood tests. It will also guide them as to what we're needing for your requirements. There's information here on adding your COVID-19. You can also choose to decline to do the updated dose if you choose, and you can include that on this form. We also have listed highly recommended immunizations. These are really useful to have for a protection, also for clinical reasons, like if you plan to do study abroad or travel at some point during your university time. These are really useful vaccines to have in your chart. You have the option of also adding these dates. Also, many of you will be coming to us as your primary care providers, so providing your healthcare while you're a student, and so this information is also very useful for that. And then it goes into the COVID-19 vaccine mandate, how to submit that. The declination form is also in here. And then down below, we have all sorts of information. One is on medical exemption. If you need a medical exemption due to allergies or reactions, or you're immunocompromised for some reason, this is the form that you would take to your healthcare provider to have filled out and signed. And we do require that these are fully signed with the license number, etc., of your healthcare provider. We also have in one place all of the forms. Now, the School of Medicine, School of Pharmacy, and the PA is our professional medical programs, so you won't be using those. You'll be using the regular forms here. We have really helpful links if you want to know anything of what sits behind our policy for incoming requirements for students. If you're on this call and you're going into the Extension International program, there is some information there for you. And then the final part of this is specifically for our School of Pharmacy, Medicine, and Physician Assistant. There is also good information there on how to ask any questions that you might have, and we will also cover that. So just remember, you can come to this website at any time and get all this useful information, including a link to log on to My Student Chart. So this really is a good one-stop shop for all of your health requirement needs. So I'm going to stop sharing my screen now. Thank you so much, Helen. And the next part, and the most important piece really, and I'll tell you why that is in a minute, is signing up for your My Student Chart. So what you need to use is your UCSD Student AD, which is your email login and that password which you are given at some point after accepting your position at UCSD. And then if you have any issues, I do have a link on this slide for the university to assist you. The next piece that's required on our end is that we have uploaded your demographic details into the electronic medical record, and this is done on a weekly basis. So if you're a later acceptance, then it will take probably a week before you can see yourself in Epic, and that you will actually be able to see all of the requirements in My Student Chart. And then the picture at the bottom of this slide is literally just letting you know, reminding you that on our website, you will be able to link to your My Student Chart. And then this is the landing page, and I'm going to go through this with you in a moment in a live demonstration, but I just want to really highlight, as many students make this error on logging in. So you need to do the circled piece, which is using your AD login, not the bottom piece that asks for a MyChart username. That is for regular UC San Diego health patients, but that top login is specifically for students, and so it's very important. If you go in the wrong way, it'll start prompting you to do all sorts of weird and wonderful things like requesting a link, and you won't see the incoming health requirements. You won't see anything pertaining to yourself as a student. And so if you get in there and it's just all confusing and doesn't quite look right, go out and then go back in through the AD login, and you are most likely to see the correct place that you need to be. You can, the first time you log in, the recommendation is that you do it on a desktop or a laptop rather than your phone. So you can download the My Student Chart app on your phone. Make sure it is My Student Chart, not My UCSD Chart, because that again is not the right one. And you can have it on your phone, and this is a wonderful way of communicating with us, booking online appointments, and all sorts of features. But sometimes doing this process, it can be initially a little easier from a desktop or a laptop. If you're having issues, then perhaps think about doing that. Next slide, Helen. And our next thing we're going to go through is a live demo of My Student Chart, and I'm going to show you all of the ways that you can get to the places you need to be for all of your incoming requirements and uploads. So I'm going to share my screen now. Perfect. And so this is a this is a test environment, so it looks slightly different. On your version, this will say My Student Chart, and you will be logging in using your student login here. I'm using a test patient, obviously not a real patient, and for purposes of this demonstration only, so I'll be using the piece I just told you not to use. And this is what yours will look a little bit different, especially as you're brand new to Epic and to My Student Chart. This is a test patient that we use for all sorts of things. So you'll see all sorts of weird and wonderful when you land here. But what I want to highlight first of all is messaging. And so to contact the nursing team regarding any aspect of this process, go to menu and go to Student Health Ask a Nurse. So you can just push that and send a message directly to us. You can pick a topic from our list, and it's got all of our most commonly reached out for topics, and type a message. You do not need to put your student ID or PID down, nor even your name specifically, because this message comes to us with already preloaded. The system knows that you've logged in as yourself, and it gives us all those details. So you don't need to include all of that unless you really want to. And this is for non-urgent issues only. And this is responded to through in Pacific Standard Time through till about 9 or 10 o'clock at night. So many of you will be in different parts of the world and different parts of the States. And so please allow about 24 hours for your question to be answered. I do have a nursing team that's responding to these all through the sort of normal clinic office hours in Pacific Time from 8 till 4:30. And then I do have nurses that work remotely that start picking up this after our clinic closes, and then also in the weekends. So you might get responses at funny times of the day and night, but yeah, we do get a high volume of questions. And so if it's taking a little longer, just please give us a moment. But we do have a good team of people ready to respond to any of your queries. And we're already receiving lots of questions from you all at the moment, which is great. Now we're going to go, and I want to show you where to go for your tuberculosis and your main part of your immunisation. So go back to menu and scroll down to immunisations and screening and click on that. And this is where you will see both of the main areas that you're going to be submitting both information and documents. And so for the TB screening, when you do this, it's going to start asking you a whole lot of questions. And I'm not going to do it now, but the first question is, are you a first year healthcare professional? And it would be no, trainee healthcare professional. And then it will take you into the rest of the questions, and you'll answer yes or no to all of those questions. When you do a final submission, it will either say, congratulations, you have completed your TB incoming requirement, or it will say the system recognizes that you may be at higher risk. Please take the TB testing form to your healthcare provider to obtain testing. And I'll talk a little bit more about what testing that we are looking for with that. So that is the TB screening. Now, if you are prompted to provide TB testing, then this won't disappear, and it'll have a little upload button remaining there until you bring back your form with your testing and you upload it into here, and then it will disappear and it will come to the nursing team. Same with the immunization history screening. So if we go into here, you will see all of the little spaces available for to enter your immunizations. And if you hover over the little bubbles, it'll give you more info about this requirement, and that is mirrored on that form that I showed you. So for measles, mumps, and rubella, 2 doses of that at least 28 days apart. And so it goes through all of the different vaccines. Some of these vaccines are highly recommended, not required. Some are required, but it will let you know that. And then you can upload as many documents as you want here. You can upload an electronic copy of the form I showed you. You can upload your own vaccine records from your own healthcare providers or schools or whatever. Anything is fine. If it's not clear enough or we need more documentation, when we process this submission, we will message you. So please turn on your notifications so that you get an email or a text message to know when we've sent you a message. Many students come back, start at school, and they're like, oh my goodness, I didn't see all these messages from the nursing team, and now I'm not in compliance and I'm about to get a hold. So it's very important that you keep checking that we may have communicated with you and need something additional. So that is the immunizations. So one more place I want to take you, and this is COVID-19. So I think you can go to it from here, or if you want to go to it through the menu, you go to COVID-19. So COVID-19, because it is a more recently required vaccine, it kind of sits independently of the others. And so you will see a whole lot of stuff. You can hit update. And what this is doing is if you're in any sort of registry, most primarily in California, it will pull that information in. However, if you are in the EPIC system, even in another health system, anywhere technically in the US, it will pull in your immunization and not just COVID-19. It will pull in your other vaccines, so it will save you a bit of time. So it's really good to do this first, and it will deposit that information in, and we'll be able to review that information, which is great. So really good to do, press that button and get as much information in there as you can. What else do we need to think about? I think that's mostly it. For all of the requirements and the messaging within here. My student chart will be something that you use quite a lot of, and so really important. The other reason that's very important to set this up even before you're ready to go is that I start sending reminders and from now on right through to as we come up to the deadlines and then the whole deadlines, and then through the full quarter. So once you've signed up, it enables me to message you. If you don't sign up, I'm not able to message you, so you won't see those reminders. Now, you may see some reminders in your email. I do try and send some out that way for folk that haven't yet signed into my student chart, but it's much, much easier if you've already done that to communicate with me through here. We'll carry on now. Wonderful. So I think we've covered everything on here. Wonderful. And so now we're going to just talk a little bit more about the TB risk screening. So as I said, you're going to answer 5 questions. Our deadline for everything is July 10th. Now the hold for TB is the first academic enrollment hold to go on, and we'll talk some more about that, and that goes on at the end of July. So really important that you attend to this one as soon as possible. The TB testing can include skin tests. So that's when a nurse or a medical assistant would inject a little bit of tuberculin under the skin and then read it in 48 to 72 hours to see if there's been any reaction. The next type of testing is IGRA blood testing, which the brand names can include QuantiFERON or T-spot testing, depending on where you are in the US or the world or which lab your healthcare provider uses. That is really the gold standard. So if you can access QuantiFERON or T-spot testing, we would really highly encourage you to do that. If not, these other ways are also an option. Now, the third way is a chest X-ray. That is our least preferred way because that tells us whether you do or don't have active TB, but it doesn't tell us something else, which is called latent TB. So it's really, our preference is IGRA or QuantiFERON T-spot blood testing. Second would be the TB skin test, and third would be chest X-ray in terms of preference of screening. Now, if you do a TB skin test or an IGRA test and either of those come back positive, you will be asked to do a chest X-ray regardless. So just to bear that in mind, this is why we ask that you get onto this process as early as possible, because sometimes you're going to need more testing. And if some abnormality shows up in your chest X-ray, then there's even more testing that we will be requiring from you. So it's really useful to start early, so it gives yourself lots and lots of time to get onto any of these additional pieces. It's a registered nurse here at Student Health that will exclusively be looking at your TB testing. And as I say, messages will be sent letting you know that messages will be sent if you submit testing and that testing is good and you are complete, or if there's missing items or we need more follow-up testing. So please start that very soon, as soon as possible. Next slide, please, Helen. Thank you so much. And the next thing I'm going to cover is the regular immunisation requirements. Again, deadline July 10th, but holds are not placed actually until November 1st. So you do have a little bit more time with this one. We ask that you get them in as soon as possible. However, we are aware that in many parts of the world, there are certain vaccines that are not readily available, or there are issues around cost of vaccines before you start school. So we do allow the first part of the full quarter for you to catch up on this. For many people, that means that you're going to come to student health to get those vaccines, which is totally fine, or blood tests. Many of you will be taking the school insurance, which is called UC SHIP. And so all of these vaccines are free of charge under UC SHIP. Some of you may choose, and I would highly encourage it, that you'll have your outside own insurance, but there is an option to take up RAFT, which is an access fee, which means that most things in-house are free of charge, which may include, titer tests, which is a type of testing that you can do instead of a vaccine to see if you've got immunity. And the quantiferon TB test is also free of charge under RAFT. So, and also many other things like SDI testing and pregnancy testing, etc. So it's a real advantage. It's very low cost, and it just means that you can use the student health clinic for low cost during your time at school, even if you don't take our UC SHIP. But our UC SHIP insurance is very, very robust, and it's a wonderful healthcare policy to have. So you want to obtain your vaccine records for the required vaccines, use our form to guide you. As I say, there are also strongly recommended vaccines that are useful to have. You can use your healthcare provider to fill out the form, or you can just go ahead and enter the dates from your own vaccine records, and you can submit even if you know that you don't have all of the required vaccines. Say, for example, you can't get hold of Tdap in the country you're coming from. Just submit the vaccines you have and then get that missing one either at school or in the US when you come. And just a little bit more detail on each of the vaccines. So Tdap is the adult tetanus, diphtheria, and pertussis is whooping cough, which is what we want you to have protection from. So you need to have one dose on or after the 11th birthday. Generally speaking, Tdap or TD do not meet the requirement, although there are a couple of countries that have an adult version of DTaP, but we will work with you on a case-by-case basis around that. The next one is varicella, which is chickenpox. So you either need to have had 2 doses of that, with the first one being on or after your first birthday. Sometimes people have received it too early, and that dose will not count. The 2 doses need to be at least 28 days apart. If you have had chickenpox as a child, or you can't obtain your vaccine records, or there's some other anomaly, you can go ahead and have a blood titer, which is a blood test to check for antibodies. Same with MMR, exactly the same rules as varicella. MMR stands for measles, mumps, and rubella. For some of you, you may have had single vaccines, so you need to have had at least 2 doses of measles and mumps and 1 of rubella. But for most people, it's 2 doses of MMR. And again, you can obtain blood testing. We may ask you to obtain blood testing after you submit. The 4th vaccine is meningococcal. This is required for students up to the age of 22. As soon as you turn 22, you're no longer required to have this vaccine. But if you're younger than that, you will be required to have 1 dose on or after your 16th birthday. Brand names in the US of this include Menatra, Menveo, or Menquadfi. This requirement does not include meningococcal B vaccine. That's something you may choose, or your healthcare provider may have advised that you get. It is not required by UC San Diego. The vaccine is the one that covers A, C, W, and Y, just to get into the weeds there. But if we have any questions when you submit, we will send you a message. The COVID-19 vaccine mandate, I showed you where to enter that. what the requirement is now is an up-to-date single dose. And so it doesn't really matter what you had at the beginning of the pandemic or even boosters after that. What matters for this requirement now is that you have had a dose since September 2023 in the US of Pfizer, Moderna, or Novavax. You can postpone this by letting us know until the fall, and you can get it then. We're still vaccinating people with the September 2023 updated version of these vaccines. And then I anticipate that the CDC and FDA will release a new version, much like the updated influenza vaccine that comes out every fall to protect people through those high-risk fall and winter months. The vaccines are available at Student Health, or many retail pharmacies will have that. And under all US insurance policies, this vaccine will be free of charge, but you will need to check where your insurance company covers you. If you take UC SHIP, obviously it will be covered here at UC San Diego Student Health, and we have lots of very high volume clinics running through the fall where you can come in very quickly and get these vaccines. You can choose, as I mentioned, to decline for religious or strongly held belief, and you can decline that on the main immunisation form, or we have a specific form for that on our website. And medical exemptions are available if you had a past reaction to other vaccines. If you had a past reaction to Pfizer or Moderna, we might suggest that you get Novavax, which is not an mRNA vaccine. So some people did have reactions to the mRNA, but Novavax is available not here at Student Health, but in many retail pharmacies. We may have it in the fall. Just want to go over a few frequently asked questions. If you're having trouble finding your vaccine records, you may need to go back to your healthcare providers, hospitals, clinics, your high schools or other colleges if you're coming in as a grad student. So you can request those medical records to utilise. If you can't get any of your vaccine records, you will need to take our form to your healthcare provider and get blood tests to see if you have had vaccines or illness for MMR and varicella, but you will need to get an updated and documented dose of Tdap and meningococcal if you're under the age of 22 for meningococcal. As I said, if some of these vaccines aren't available to you, yes, you can get them at Student Health by appointment, and all of our vaccine appointments are available through self-scheduling through My Student Chart, so it's super easy to select a time. The schedules open up on My Student Chart a month out, and so those book up really fast, so I would encourage you to book ahead. Book early if you need to come into this clinic to get these vaccines. As I said, there is no charge with UC SHIP. If you have outside insurances, you can obtain many of them, as I said, through retail pharmacies here in the US, CVS, Rite Aid, Costco, lots and lots of retail pharmacies will have them. If you don't have UC SHIP, you can choose to get them through us and seek your own reimbursement through your insurance company. But that responsibility will be yours, and we will bill your student account, and you will need to pay those. And then at the bottom there, COVID-19, flu, Tdap, and HPV are in these very high volume clinics. So those are really easy vaccines to obtain. And a few more. So in some countries, they administer a TB vaccine called a BCG, and many people reach out to us asking if they still need to get TB testing, and the answer is yes. By sheer reasoning that if you got a BCG vaccine, you are actually living in a country with a high incidence of TB. It does not offer lifelong protection, and it does not protect you against something called latent TB. And so you will need testing. If you're not sure whether you had a BCG vaccine, you'll be able to see a little indentation on your upper arm, and that is most likely what that was. If your skin test is positive or your blood test, you will need to get a chest x-ray from your healthcare provider. If your medical records are not in English, you please have them translated. If you do a chest x-ray, you will need to submit the chest x-ray report, and that will need to be translated into English. If your religious belief excludes vaccine, you will be able to decline the COVID-19 vaccine, but it is the only vaccine in this category that you can decline for that reason. But if you have allergies or other medical reasons, you might be on immunocompromising medication, that vaccines are contraindicated. In that case, a medical exemption form, a medical exemption is what you will need to pursue. And then just a note about deadlines and enrollment hold dates. For TB, you will need to have completed the questionnaire and TB testing if it's indicated. Deadline is July 10th and holds are placed around July 30th. Now, we have enormous number of submissions of questions and forms through this time. And so getting it in as early as possible is an advantage to avoid a hold. Once a hold is placed, the way to get that lifted is by doing what is not being done, and we will lift that hold. They're automatically lifted within 24 hours during Monday to Friday, and then if you lift the hold on Friday or the weekend, it'll be lifted on midnight on Monday. And so an enrollment hold will prevent you from enrolling in classes, and I know that the first year classes fill up quick, so you really do not want to have a hold on your account. Immunizations, we do ask you get started on this process as soon as possible, and then get any missing vaccines or blood tests during the full quarter. Submit everything before November 1st, and as holds are placed at that time. And again, that will prevent you from enrolling in classes in the winter, so you don't want to be prevented from that enrollment either. If you need help with this process for any reason, assuming you can get into and your problem isn't getting into My Student Chart, you're going to send a message to Ask a Nurse to have one of us help you with whatever you need. If you are having technical difficulties signing up for My Student Chart, then there is an email here, shstb@health.ucsd.edu. No health information should be sent there, so it should just be help, I can't get into My Student Chart, or I can't upload my forms, or something along those lines. Email is a very unsafe way of sending protected health information, and we really don't prefer this way. That's why we want you to message us within My Student Chart, because it's HIPAA protected and very locked down. Everything is on our website, and as I said and have said multiple times, just get onto this as soon as possible so that you can get your requirements done, and you can move on to the next part of whatever you need to do as part of your registration and enrollment into UC San Diego. And then this is some of the nursing, just a little splatter of the nursing team. There is more of us than this. So this was on Nurses Week. And so we took a photo of our team, and we're here to help you by answering questions and guiding you in this process. So please know that we are doing our best to provide as much support as we can to assist you in this process. And we're going to answer some questions now.
All right. We'll be answering questions in the order that they are received from our question and answer portion here. There was a student that says, I was vaccinated for TB when I was a kid, so testing always comes up positive. And I had to take a test x-ray. How do I provide the results?
Yeah, so we definitely went through that. So if you were vaccinated, if you can get a quantiferon test and or a chest x-ray. So a BCG will not positively cause a false positive with the quantiferon blood test, but either chest or blood is available to you, and you just do it, follow the form, and it's no different than if you were getting a skin test.
If you've already had TB testing, is there a way to submit the results, or must you take a new test?
If that test was between September last year and September this year, you can just submit that test, and that's totally fine. So it needs to be current, though. It can't be older than a year.
If you decide to take courses this summer, do you need to complete the health requirements before the summer session?
The preference is yes, but you are still held to the same deadlines as coming in for the fall.
Do we need to start taking the test if we don't have the appropriate vaccines or proof, or first fill out the immunization form first on my student chart with the ones that have already been taken?
If appropriate vaccines, you can do a partial submission, yes, or you can save everything you have had and go to your doctor and come back. It's really up to you. What I will say is you can only hit submit once. So if there's lots and lots missing, you'll have to send us messages through Ask a Nurse for anything that you got after that time. So that's just a proviso on that.
Lots of question on COVID-19. Is the
Mhm.
COVID-19 vaccine required?
Yes, it is. And an updated dose is what's required.
Is there anything else we need to do for COVID vaccine after sending the vaccine exemption form to Ask a Nurse?
No, we will send you some information about other precautions that you may need to take as not having had that vaccine. And so other than that, no, we will mark you as declined in the system. So nothing else is required.
I searched the options that they have in my city for doing the TB requirement, and the only option that was available was the X-ray. I would like to know if it's enough.
Yeah, it's enough. It's fine.
I already submitted my immunization. Approximately when will I know if it was approved or processed?
If you completed everything perfectly, we won't necessarily reach out to you. If you would like to confirm, you can send us an Ask a Nurse message and we will let you know for sure.
If two COVID-19 vaccines complete in 2021, do you have to take an updated dose or can you decline that?
You can choose to decline, but obviously we want you to be protected and we want our community to be protected as possible. So we would prefer that you take an updated dose. You could postpone it and get it when you come here in the fall.
Can you complete the requirement with student health insurance the school provides? And then would you also be able to complete them at the school clinic?
The answer is yes, you can. But what I would say is if you need TB testing, it's going to be a little bit late. For the vaccines, yes, you can. Most likely you will have already received some, so you can partially submit what you do have and then get the missing ones with us during the fall.
I would like to know if you accept the photo of the certificate that is on the vaccine card as proof for the vaccines.
I'm not sure, just the photo itself, if you're submitting records, it really needs to have your two identifiers on it. So your name and date of birth. The photo really is neither here nor there with identification because obviously we can't compare that to anything.
Um, if we have immunization record that's already on hand, will we have to transfer the information to the form that you had shown on the screen?
No, you don't. You can just use your own record and upload a copy of that record. And we would only ask for additional if something wasn't clear.
I am an international student from India and I plan to come to the US only late July. Do I have to do TB screening in India?
Let's deal with the TB question part of it first because I see there's another piece there. The preference would be yes, but you could get it done here in the US if you wish to. So yeah, it's your choice really, whichever is easiest for you, bearing in mind around the 30th, 31st academic holds are going on. But yeah, you will possibly have time to get that done.
And then if I do not have records of the immunization, what is expected?
Um, you can get blood tests, which you could get here or in India, and catch up on anything else that's not blood testable, which would include Tdap.
And then Can I take this? I'm guessing the students alluding to immunization and TB testing as they
Mhm.
don't have insurance or Medi-Cal.
Mhm. Uh, yeah.
For blood tests, do I need to provide a report or is the titer date sufficient enough for the incoming immunization requirement
Um,
form?
It will ask you to upload something associated with a titer. Now, if you've had a healthcare provider fill out your form, you can just upload that form. And many people, though, it is easier to upload copies of the report if you can get hold of it.
Is the TB testing form on the website versus the one on my student chart? Is there any difference between those two?
Um, the My Student Chart questionnaire um, is 5 questions. What's on our website is the form. So one is the risk screen and the other one is the testing form. So they're 2 different things, if that's what your question is.
And then do we need to download the form, print it, fill the details manually, and then upload the scan?
Um, if you're using our form, most likely because you will need to get it signed by a healthcare provider.
Can vaccine records be submitted instead of the immunization form?
Absolutely.
If I have obtained the quantiferon test recently as part of the separate testing for uh, another purpose, can I just use that as proof or do I need to get it redone?
No, you can use that. Just upload the result and if we have any more questions, we will reach out to you.
I already received my Tdap vaccine and my immunization are already on file, but it's been more than 10 years since my last Tdap dose. Do I need to get another dose before the deadline?
No, you don't. So as long as you've had a Tdap since the age of 11, you'll meet the requirement. The update, the boost is to prevent tetanus if you get an injury, break to the skin. So no, the Tdap will satisfy the requirement. If you've been an undergrad here, just make sure that you will need to repeat TB risk screening questionnaire and testing if indicated. But if your immunizations are already on file from previous incoming, that will just cross over. But if there are missing pieces, then you need to make sure that you update those. So you'll need to send that to us directly through Ask a Nurse.
What do I do if the Tdap and COVID immunizations were taken outside of the US?
It's okay as long, as I said, the current requirement is an updated dose since September 2023. As far as I know, no international brands like WHO approved vaccines updated apart from the US ones. If you're coming from Europe and you received an updated dose of Moderna, Pfizer, or Novavax, not a problem. If you're DTaP, if you're coming from Europe and it's been since you turned 11, you're fine. If you're coming from anywhere else in the world, probably those vaccines aren't going to be the right ones. So submit and we will communicate with you directly.
MCV4 is mandatory only from the ages of 16 to 23, right? If you're above that age, is it necessary to fill it out?
It's mandatory or required up to the age of 22. From 22 to 23, it's strongly required and not required. So MCV4 is the required meningococcal vaccine.
Are proofs of immunization vaccination from another country like Egypt accepted?
Yes, they are, as long as we can understand the form. If it's you may need to get it translated, but if it's already translated, many countries do have translated forms already, then absolutely.
My last dose of COVID-19 vaccine was in 2022. Do I need to get another dose?
Yeah.
And does it have to be from a specific pharmaceutical company?
It just needs to be an updated dose from September 2023, and the only ones I know that have done that are Pfizer, Moderna, and Novavax. I don't have any personal connection to those companies, but those are the only ones in the US that updated to reflect the current variants circulating in this country, and they plan to do that again for the upcoming fall.
Will we be notified via email or My Student Chart when our immunization documents are processed, even if nothing additional is needed?
As I said, if everything is complete, you may not. Although often I do a mass blast out to everyone to let them know that they don't have to be concerned around the hold date. We usually only get notification that you've submitted if there is something that didn't meet the requirement, or you may have made an error in putting in a date. That happens quite a lot. But you are, as I said before, welcome to send us a message through Ask a Nurse to find out, and we can work with you individually.
I will be turning 23 in a few months. Can I avoid the meningococcal vaccine?
It's no longer required for you.
Okay. Is there anything else we need to do for COVID vaccines after sending the vaccine exemption form to Ask a Nurse?
No, there isn't.
So we can wait until we're on campus to complete our vaccine through the student health clinic, is that correct?
Correct, you can do that.
Let's see here. Is it possible to decline the influenza vaccine?
Yes, it is.
Right. Is the meningococcal ACWY vaccine the same as the MCV4?
Yes, it's a slightly different formulation, but it is accepted, yes.
Right. There's a question that says, my daughter didn't get the adult Tdap vaccine yet. Must we finish the 2-dose vaccination before school enrollment?
It's just a single dose, actually, Tdap. I'm assuming that your daughter received the primary series as a child, which is the DTaP, and so this requirement is just one booster on or after the 11th birthday. So it would just be one dose of that vaccine to complete.
If I have obtained the QTF test recently as part of a separate test for, I think we answered this question already.
Yeah.
All right. Another one says my application portal says you see immunization requirement due completed. It says that you have satisfied the immunization requirement, but my student chart is still saying that the meningococcal immunization is not yet met. Do I still need to get it done?
Yes, so your applicant portal does not tell you if you've met requirement because your health information is protected in the US. So our system does not communicate with your applicant portal. It's probably telling you that you've read that part of your applicant portal, not that you've completed that part. You should rely on my student chart as the point of truth and messaging from the nursing staff.
Could you please clarify the deadline again? When is the deadline for the immunization and TB?
July 10th. The slideshow, hopefully I put July. If I put June 10th, it's an error. It's July 10th, definitely.
How can we postpone the COVID-19 requirement to fall 2024? And are there holds placed for this?
If holds are placed for COVID-19, it wouldn't be until the fall. So to postpone, you can send us a message or write it on your form, whichever's easiest, and we'll just make a note of that in your chart.
TB blood test will cost me around $300. Can we postpone it until joining UCSD?
Not really, because the deadline, so TB, we are trying to prevent active TB from coming onto campus. So we absolutely require and place holds prior to coming. So you can't really delay this. What I can tell you is if you You do have the right to access us as a fee-paying patient during the summer, and our cost is more like $75 to $95 for that test. So if you are in San Diego, you potentially could come have it here. The other alternative would be to get a chest X-ray, which would be cheaper than $300 in most places. So yeah, if you need more support around this, please message us and ask a nurse and we can help guide you.
Right. Here's some insurance question. Do I need medical proof for having reactions to COVID-19 vaccine?
Um, to apply for a medical exemption, your healthcare provider will fill that out. And so they will be the ones attesting to the fact that you've had a past reaction. But you could also choose to decline the COVID vaccine and you would not be asked for additional proof.
If I do not have one of the recommended immunization, but I have all the required ones, are there any consequences or setbacks?
No, not at all.
If we get required vaccination after the deadline before fall quarter, can we still get vaccinated and upload through the website?
Yes, yes, as long as you haven't submitted before. But if you come and get them here or anywhere else, we can pull them in from CVS. Just let us know that you've had it, or you can send us a message, upload proof, and we will update it for you.
How many days does it take to be informed that we have satisfied the immunization requirement?
7 to 10 days.
How do we know if we need to get a TB test?
When you finish the TB risk screening questionnaire, it will say either well done, that's it, or please go get testing. So that's how. So always go in and do that questionnaire first, because you may not even need to do testing.
If I don't get UC ship, can I postpone the vaccine requirement to November? I will get the required vaccine in the US when I arrive.
Yes, you can do that. You wouldn't even need to postpone as long as it's in there by November. We wouldn't necessarily, I might start sending you reminders. That will be the only consequence. So you can definitely, if that's easier, and I know it is easier for some folk, then that's fine.
The declination form is a self-signed form. If that is a personal choice, is it acceptable to decline? Is there a negative impact on enrollment? The form does not specify the reason. Please advise.
No, there is no negative consequence from declining. That is your choice under the policy for COVID-19 and influenza, actually.
Do we know if the Ask a Nurse message is working right now? I'm trying to send messages through and it's not working.
It is, yes, it is working. So I'm not sure why that might be happening for you. Yes, we've been in there answering lots of questions today. If you've got a whole lot of windows open, X out of all of them, close down all your apps and go back in and try again. Yes, there's no limit because we've had thousands of messages in there at any one time. So please try again.
Do we need to complete 2 screenings even if we aren't prompted to?
I'm not sure what that means, but I will say, my student chart is also just a general health chart, obviously, and it may be prompting you to do other things that are nothing to do with the incoming health requirements, like cervical testing, STI testing, cholesterol testing. You can just choose to ignore that and discuss that with your healthcare provider. That might be what you're talking about. I'm not sure. Yeah.
Must records be officially translated?
No, but if we can't understand something, we will reach out to you.
I've had 1 MMR shot, and if I remember correctly, I was told 1 shot was enough, but UCSD requires 2. Should I get
Yes.
another one?
In other countries, and when some of these vaccines were first released, it was thought that 1 would be adequate, but it is not. And that's why it is 2 now all around the world, for lifetime immunity. And in different parts of the world at the moment, we're seeing outbreaks of measles. And so that's often from inadequate number of doses. So yes, you will need to get another dose.
How can one book an appointment for an updated COVID vaccine on campus? Are walk-ins allowed?
We don't do walk-ins, but you go into my student chart and click on visits, schedule an appointment, and then you will see a whole raft of options for student health. And you can book appointments that way online and select the day, the time, and it's super easy to do.
Another question's on how do I know if I need TB testing?
Just if the system tells you.
Right. My last COVID vaccine was in August 2023, and it was my fourth one already. Do I need to take another one?
What I would recommend is waiting until a new one comes out in fall 2024 and receiving an updated dose then, because you're right, it's very close together of the up next available. So yeah, just wait until the next one. And then it would have been
Is
a whole year.
perfect. Is my student chart just for SHIP students or students who have waived can still have my
It's
student chart?
for everybody. There are many services through the clinic here that all students have the right to access our clinic, and there are many services that are free of charge through health promotion. Students use our services for a range of reasons, not just for sort of traditional healthcare provision. So yes, it's available to the entire student body.
Would it be okay to register for another session of this case if my parents want to attend?
Yes, absolutely. As many as you need.
Yes, so we're at time. However, like we said, there are 3 more sessions. If your questions wasn't answered at this time, please go ahead and message Ask a Nurse. Thank you for joining us today, and we hope to see you soon.
Thank you so much.